Hello, I'm Julie Morrison. I'm the Vice President of Regional Operations for the Northern Region of FNHA. And I just wanted to take some time today to share some of the great work that our staff have been doing here in the Northern Region of FNHA. The work that we have ahead of us is around stigma reduction. We want to work with our communities to provide more information on harm reduction and also to create videos and workshops around reducing the stigma when it comes to toxic drugs. In the Northern Region, we have been working with the Office of the Chief Nursing Operator in regionalizing the nursing services that FNHA currently provides to communities. In the Northern Region, we provide services to 6 nursing stations and 8 health centers that are FNHA run. And so with the transfer to the regions, we have been working with communities and making sure that we are providing service, building connections and relationships with our communities in a different way. This is a really important time as well for our communities in the Northern Region, as we will be standing up 3 First Nations primary care sites. We have 2 sites that have been identified, and we're currently working on the 3rd site, working with the community and the surrounding medical health care systems that are in place so that we can build a care center that will be providing primary care and including First Nations culture and protocols that are relevant to the area. So one recent highlight for our staff and colleagues across the region was the first in-person caucus since the pandemic began. It included quorum that enabled us to take decisions that will improve the delivery and impact of health services. We also had opportunities to meet with our partners, and we had signed the Northern Partnership Accord with Northern Health and FNHA and our First Nations Health Council reps. This was a very big day for us all in the North, as this document has been a long-standing document that needed to be signed, and it'll lay out how we're going to interact with Northern Health as we go forward. I just wanted to talk for a moment as well about the funding agreements that we can currently work on in the Northern Region. We have hired 3 planners that are working with our communities to help make sure communities are able to access funds that are available and helping the communities develop plans that are according to the community's needs and wants and protocols and culture. So we continue to work on COVID with our communities. We're working with our nursing team to make sure that the vaccine is going to be available in your communities. And we encourage each and every person to ensure that their vaccines are up to date and that when the opportunity comes that you take that opportunity to protect yourself, your family, and your community. We also have been providing support through the Director of Health Emergency to the communities that have been impacted by fires for this year. And we're just so thankful for all of the work that the communities do. We know you've been challenged. You've had many things come your way when it comes to the pandemic, the fires, and COVID. And we just want to applaud each and every one of you for the hard work that you've done, for the commitments that you've put forward to make sure that your communities have stayed safe. So I would like to end by urging us all to stay healthy. And one good way of doing that is to keep your vaccinations up to date for the sake of your family and your communities. Take that time you need. Get the rest you need. Thank you.